If other treatments for psoriasis haven't been effective, your doctor may recommend a type of medication known as biologics. These drugs target the underlying causes of psoriasis rather than just treating the symptoms. Biologics work by blocking certain cells or proteins in the immune system that are involved in psoriasis. This helps to reduce inflammation and other symptoms, but it can also weaken the body's defenses. A weakened immune system can make you more susceptible to infections or diseases, and can also cause a previously controlled condition, such as tuberculosis, to become active again. It's important to be aware of any signs of infection, such as fever, chills, fatigue, or body aches, and to contact your doctor if you experience any of these symptoms. Some biologics are administered as injections under the skin. Your doctor or nurse will teach you how to do this at home. Others are given intravenously, meaning the medication is administered through a needle in a vein in your arm, which is done in a medical setting. New biologics are constantly being researched and developed, so there may be additional options available in the future. So, should you take a biologic for your psoriasis? Here are some things to consider. First, how much of your skin is affected by psoriasis? Doctors often use biologic drugs on people with moderate to severe psoriasis. If 3% to 10% of your body is covered with red, scaly patches, it's considered moderate psoriasis. If more than 10% of your body is covered, it's considered severe. However, even if you have mild psoriasis, but it really bothers you, you may still want to consider taking a biologic drug. Next, consider how much psoriasis affects your life. If your psoriasis doesn't bother you much, the doctor may advise against taking a biologic drug due to the risks and costs involved. Biologics can make you more likely to get an infection and can be quite expensive. Your health is also an important factor to consider. Biologic drugs may not be suitable for people with certain health conditions, such as a history of infections like tuberculosis, a history of cancer, or a weak immune system due to a disease like HIV or cancer. It's important to discuss your health history with your doctor. Insurance coverage is another consideration. Insurance companies often want doctors to try less expensive treatments first before covering the cost of a biologic drug. And finally, your preferences also play a role. If you're afraid of needles, for example, it might be easier to take an oral drug or topical treatment instead of a biologic. It's important to consider what method of treatment you're comfortable with. So whether you begin with a biologic drug or switch to one after trying other treatments, you should expect to see significant improvements. It's important to follow your doctor's instructions for the treatment and attend regular follow-up visits to ensure the treatment is still effective. During your visits, make sure to discuss any issues or side effects you may be experiencing. For psoriatic arthritis, biologics can be taken in a pre-filled pen or auto-injector, giving yourself a shot once a week. Your doctor may start you off with an intravenous dose, then have you give yourself a shot the next day. Or you can get 4 doses only. The procedure will take about half an hour. You'll get another dose 2 weeks later and a third dose 2 weeks after that. Then, you'll get infusions every 4 weeks. This biologic treats plaque psoriasis and psoriatic arthritis. You administer it to yourself with a shot every other week. However, be aware that there are potential side effects, including serious infections like tuberculosis, higher chances of certain types of cancer like lymphoma, and autoimmune disorders such as a lupus-like syndrome. It's important to note that people with heart failure or multiple sclerosis should not take this medication. If you're considering other options, there are FDA-approved medicines called biosimilars that are highly similar to Humira, such as adalimumab, Amjevita, and adalimumab, Siltezo. These may be worth exploring as an alternative for you. This medication is used to treat plaque psoriasis. It is administered as a pre-filled syringe, and the typical dosage is 1 shot per week for 3 weeks, followed by 1 shot every other week. It's important to note that there is a potential increased risk of thoughts and actions of suicide for some individuals who take this medication. Therefore, it's recommended that doctors carefully consider the risks and benefits before prescribing it to individuals who have a history of depression or suicidal thoughts. This biologic is used to treat psoriasis and psoriatic arthritis. It is administered through a pre-filled syringe. On the first day, you will give yourself 2 shots, then 2 weeks later, followed by another 2 weeks. After that, you can choose to take 1 dose every 2 weeks or 2 doses every 4 weeks. If you experience symptoms of an infection such as cough, fever, or red and painful skin, be sure to inform your doctor. And if you have multiple sclerosis, this medication is not suitable for you. This biologic is used to treat plaque psoriasis and psoriatic arthritis. You will need to give yourself a shot twice a week for 3 months, and then once a week after that. Some side effects include skin irritation and rashes. However, if you have multiple sclerosis, a weak immune system, hepatitis B, or heart failure, you should not take this medication. Another option to consider is etanercept SCZS, Erelzi, which is a biosimilar medication approved by the FDA as very similar to Enbrel and may be a suitable alternative for you. Biologics are a type of medication used to treat psoriasis and psoriatic arthritis. They come in the form of a pre-filled syringe or an automatic injector, and you'll need to give yourself a shot every 4 weeks after the initial 3 starter injections. However, it's important to note that biologics may increase your risk of getting an infection. Before starting biologic treatment, you will need to be tested for tuberculosis and hepatitis B and C. This medication is used to treat plaque psoriasis, a common skin condition. It is taken through a pre-filled syringe, with the first shot followed by another one 4 weeks later, and then one every 8 weeks. Some possible side effects to be aware of include headaches, diarrhea or other stomach issues, pain or swelling in your joints, and upper respiratory infections. Biologic medications are used to treat plaque psoriasis and psoriatic arthritis. These medications are administered through an 4 and each session typically lasts 2 to 3 hours. After the first dose, you will have follow-up appointments 2 weeks and 6 weeks later, and then treatments every 8 weeks. There are also other options such as infliximab DYYB, Inflectra, and infliximab Abda, Renflexis, which are biosimilars approved by the FDA as being very similar to Remicade. These alternatives may be an option for you to consider. This medication is used to treat plaque psoriasis and psoriatic arthritis. It is taken as a shot that you give yourself every 2 weeks for 12 weeks, and then once every 4 weeks after that. Some of the most common side effects include upper respiratory infections, nausea, and fungal infections. Before prescribing this medication, your doctor will check you for TB and will continue to monitor you for signs of the disease while you use it. This biologic is used to treat plaque psoriasis. It is administered through a pre-filled syringe or a pen, and the initial treatment requires 2 doses 4 weeks apart, followed by a dose every 12 weeks. Common side effects include upper respiratory infection, headache, fatigue, and reactions at the injection site. Before starting treatment, your doctor will check for tuberculosis and monitor you closely for signs of the disease while you're on the medication. This medication is used to treat plaque psoriasis and psoriatic arthritis. You can take this medication using a pre-filled syringe or a pen. You will give yourself 1 dose a week for 5 weeks, and then once a month after that. Some common side effects include symptoms of a cold, upper respiratory infection, and diarrhea. Before starting this treatment, your doctor will make sure you don't have TB and will closely monitor you for signs of the disease while you're on it. This biologic is used to treat plaque psoriasis and psoriatic arthritis. It is taken through a series of shots, with the first shot followed by another 4 weeks later, and then one every 12 weeks. While it can help make psoriasis patches thinner and ease scaling and redness, it also comes with potential risks such as an increased likelihood of certain types of cancer and a rare condition called reversible posterior leukoencephalopathy, which is a serious illness affecting the brain.